African National Congress, Comrade Gwede Mantashe, was a dictatorial approach, which was disrespectful.
Now, one of our leading stories, research released by Minister of Higher Education, Science and Innovation, Dr. Bladen Zimande, has revealed that TVET college students did not receive adequate support with online learning. The study was done by Human Sciences Research Council and Higher Health, which covered universities, TVET colleges and private colleges. Joining us now to discuss the impact of the pandemic on young people and students in the country is Dr. Ramneek Ahluwalia, CEO of Higher Health. Dr. Ahluwalia, thank you so much for speaking to us. Just give us a summary of what this research came up with.
I think the research is clearly pointing towards the fact that as the notion has been that the disease has been a very old people disease or a middle-aged disease or people living with comorbidities, and that's been the focus. I think youth in general have been neglected in the whole impact of the COVID-19 perspective. And if you understand the virus in general, the virus moves from one human body to another. It doesn't know whether this is an old person or a young person, sick person or a not sick person. So there's a huge impact of COVID-19 on young people. Just the end of May, we saw one young student dying in TUT of COVID-19 and complications, clearly reminding us of this brutal impact that it also affects fatalities in young people as much as it's far low. But the study is now indicating that we need to look at youth in perspective of totality. You know, the same young person is losing parents and grandparents and is going through this huge emotional and psychosocial trauma at home. There's a huge problem with the same young person whose parents are out of financial support at this moment, and it impacts them in their education, in their studies, eventually. It talks about as deep as issues with electricity, data issues, and how does the blended learning can actually work, which is you can't have courses, for example, plumbing, mining, electrical, totally done online, and how does institution of higher learning works closely in communication with a young person in trying to build the skill setup. So the studies looks into a wide spectrum of risk perceptions by young people on substance abuse, gender-based violence, well-being, but it also goes into deeper impacts on the financial stresses, or it goes into as deep as issues that affect them when it comes to blended learning in total.
Now, Dr. Ahluwalia, you look after almost 2 million students. How many of these participated in this research?
So 13,119 students participated. It's quite a big number, which comes from all our universities, all our TVET colleges, all our community education colleges, and some of the little sampling from even private higher education. So it's a kind of a wide spectrum results coming from the population in general.
Now, it's been about 15 months since lockdown started, or since COVID hit us in any way. And I'd like to think that some of those problems would have compounded over the last 15 months.
See, I think, these pandemics remained among young people quite a while before even COVID came. For example, mental health, substance abuse, gender-based violence, HIV. And these are socioeconomic challenges, health challenges, well-being challenges that affect a graduate into graduate competencies, our throughputs, our skills building. The whole country's economy depends on our post-school systems. That is where plumbers, miners, electrical engineers, agriculture industry, or you're talking about fishery industry, every industry is getting its skills built up from. And now, when you already are coupled in a country with which we must be respectful for the fact that our country has a huge amount of disprivileged population, the population that comes from extremely poor households. And when they come naive into adulthood, when they come into young person coming into an institution of higher learning, they are grappled with millions of other stressful challenges of survival, of competing, of existence. And then you couple this with COVID, which does not give them that absolute access that they were supposed to have in contact learning, or giving all the kind of access to libraries or access to knowledge information to be the graduate competent. And on the other side, then you have those financial stresses, parents losing their lives, or grandparents losing lives, or guardians losing lives, versus financial distress, versus a huge economic meltdown that's happening along with COVID. And that is too hard for young people. So the reality is that we have to talk about a COVID impact, because this is the next generation. How is this generation going to be in next 5 to 10 years post COVID-19? And that's the impact that we are seeing, and the kind of mindset and the competencies of skills and graduate structures that are going to come out. So I think it's a very difficult and challenging times, and we need to look at youth holistically and in total, not just from the COVID and fatality perspective of COVID.
Doctor, I'd like to dwell a little on the issue of mental health. Now, what comes to mind is that many of these youth in the TVET colleges and the universities are 18, 19, and are having to grow up very, very quickly. What are some of the solutions that you've proffered on how government or other establishments certainly should deal with the issues of mental health?
So in fact, I'm going to start by a number that I would really market through your support, and that is 0800-363636. This is the toll-free mental health helpline or crisis helpline for any student, 2.5 million young South Africans, any moment, whether it's 2 o'clock in the morning or 3 o'clock in the morning. And we totally understand what situation is at this moment in every household at this moment. You'll find a psychologist, you'll find counselors, you'll find social workers who will be 24 hours available to assist you in this difficult time. What we do not want is a young life taking his or her own life in this difficult hour. So this number is very, very critical. We have averted about 15,000 crises in just the last 6 months. We're not proud of that number. But what we are saying is, this is a reality. And there is no doubt that emotional stress, the mental health challenges have quadrupled, if not doubled, in the COVID umbrella, as much as it always existed among young people, specifically in the academic stress environment. And now the time is for them to seek help, irrespective of wherever they are and whatever time it is, because a life is very, very critical. And this is not one crisis call that I'm calling about. It's a crisis call followed up with many calls back from a counseling that happens to revive an individual back, and then link it to a psychosocial support for a chronic repair mechanisms. But I think this is very, very essential that through your medium, and also both violence and substance abuse, all have risen under the COVID umbrella, and that impacts on the mental well-being of young people. So I think if this number can be promoted and more lives can be reached out, more parents are aware that young people can access this telephone number and seek counseling and seek support, there's nothing better than saving lives.
Dr. Ahluwalia, very, very quickly, last question. One of the issues that you speak of, and certainly what's come out in the report, is the issue of finances for these kids. Has an organization like NSFAS been engaged? Because we've reported on several issues where young students are failing to get the financial support that they should be getting. Have you been engaging them?
So I think this is a global pandemic. I'm not going to be very hard on a particular organization in particular. It's a reality that the whole world is grappling at this moment. And I think it's not just the role of a government. It's the role of government with student formulations, with private sector, with communities. I know I'm talking the same thing in civil societies in particular, but I think this time we need to have a social compact among all of us together. This is really not something that with any individual or any government or any organization can solve this problem due to its magnitude or due to its 360 holistic view of it. We've had many engagements with the NSFAS and with the organizations around it. But the reality at this moment is this virus doesn't spare anyone. This virus loves to mutate. It's showing affinity to young people. Young people can carry this virus to older people very quickly, but are also equally now prone as we saw in the epidemic of India and Turkey recently, that how many young lives have been lost because of it. So I think it's very, very essential that at this moment, we all need to realize each other, work the best we can at this moment. And one more message is, please, if you get a chance to vaccinate, when you get a chance, do vaccinate, because that's the biggest arsenal we have to fight. And I'm sure sooner or later, we will have young people being vaccinated when the time will come.
Dr. Ramneek, Ahluwalia, CEO of Higher Health, that conversation speaking certainly in parts about the impact that the COVID-19 has had on young people. In just a moment, we find out how South Africa can use its history of successful vaccinations to deliver vaccinations in rural and remote areas with Ian Lester of Beyond Wireless Technologies. Stay with us.
At Telkom Business, we're all about giving your business affordable, reliable fixed-line voice solutions with added value. Make sure you have the tools to seal the deal. We're on it. Communicate smarter with our unlimited voice VoIP or copper plans for just $199 per month. Or get heard with unlimited voice fiber also for $199 per month. Call 10213, click telkombusiness.co.za or visit a Telkom shop. Switch to a partner that works harder to connect your business. Switch to Telkom Business.
Eucerin Urea Repair Plus that cares for your family's dry, rough and itchy skin. Clinically proven to soften and soothe dry skin side effects associated with eczema-prone skin. Give your family 48-hour relief with Eucerin's gold standard for dry skin. Urea Repair Plus from Eucerin.
Hollard presents big ads for small business featuring Thresh. Thresh is a proven teaching method. Get our Thresh resources online today.